Hello, my name's Emma. I'm here to tell you about Healthwatch Islington. We work to make sure local health and care services reflect local people's needs. We carry out research into local services, we talk to local people, and we ask them how their experience of services has been and how they would like services to develop in the future. As well as researching people's experiences of local services, we give people information about their rights and entitlements to health and social care. My colleague Philippa, our community link worker, can tell you a bit more about this, and I'll hand over to her now.
Hello, I'm Philippa. I'm the community link worker at Healthwatch Islington, and I run the signposting service. This really is there to help you to access services in Islington, so health services and voluntary services that you may need. At the moment, due to coronavirus, many of these or all of these organisations are operating differently. So if you have any questions about how to access your GP or dental services or activities online, do get in touch by email or by phone, and I'd be happy to help as best I can.
We're also interested in your opinion, particularly if you have used services during the coronavirus outbreak. We know that services will have been delivered in different ways, and some of this will have improved patient experience, but some of it might not have done. So we're really interested to learn from you about things that were different that you'd like to keep, or things that were different that you're glad are not the way things are normally done. Normally we'd come to speak to you in person, but with the current situation with coronavirus and social distancing, we thought we'd try a presentation and then you can contact us with your questions and we can answer those afterwards. So bear with us with this new method and thank you for your interest in what we do. So Healthwatch Islington is part of a national network. We're a charitable company led by volunteers and we're here to help Islington residents access health and care services. And we do that in two main ways. One thing we do is gather and report people's views and experiences of health and care services. And then that helps us to get evidence and help shape how those services are developed. And the other thing that we do is provide residents with information about services in Islington, and that could be anything related to your well-being. So it might be NHS services. We get lots of requests for information about registering with a new GP or dentist, for example, but it could be around much more complex services. So we've had quite a lot of queries around mental health services and different types of support for various levels of mental health need. The number one thing that people talk to us about is accessing their GP, and we seem to like that to do that in very different ways depending on the person. One of the things that people seem to find most frustrating is waiting around on the telephone, and so we want to make sure that people are aware that all GP practices in Islington do have a range of online GP services. We know it's not for everyone, but it does give you the opportunity to book your appointment online, and that might be for a face-to-face appointment or an online appointment, depending on your practice. It also gives you an advantage in that you can pick a clinician that you prefer, if there's one that you particularly like, and it also gives you a range of dates and times, so you can pick a date or time that suits you. And if you're on regular medication, then you can order repeat prescriptions using that same service, and you can view your medical record there as well. So it gives you easy access to test results and details of things like immunisations or allergies. If you're interested in signing up to online GP services, then ask your surgery for login details. You used to need to show them ID, but in the current situation, it's likely that isn't necessary. You will need to have an email address, and then you go to a website called Patient Access, and you can download an app for your phone or you can access it direct through the website, whichever's more convenient for you. Another thing that people talk to us about a lot is wanting to see a GP not during sort of working hours, but fitting around other commitments that we've got in our day-to-day life. So you can now see a GP at the weekend and during the evening. It might not be in your regular practice. So there's a service called iHub. It's run by Islington GPs, and they offer appointments with doctors and nurses every weekday evening and all day on weekends and bank holidays. And you can see the times in the slides here: Monday to Friday 6:30 to 8 and Saturday and Sunday 8 till 8. You can access the service by phoning your usual practice even when your regular practice is closed. If your practice is open, then you can ask for an iHub appointment if your own practice doesn't have appointments available. And if your own practice is closed, then you'll automatically be directed through to the iHub service. Sometimes when services haven't really worked in the way that patients or residents had hoped they would, you might need to make a complaint. Depending on the service, the complaint is usually made direct to the service itself. It can sometimes be made to NHS England. And if you needed support to make that complaint, there is advocacy available through an organisation called Power. And they've got a website, or you can call them on 0300 456 2370, and you can ask for their NHS complaints advocacy. Still on the topic of GPs, sometimes people just simply want to change their GP, or they've moved to the area and they need to find a GP. So the NHS website is a great resource for that. You can find it online, www.nhs.uk. Pop in your postcode and it will show you GP practices that are nearby. And you can use that for any services. So it could be dentists, it could be your nearest pharmacy. Of course, if you don't have access to the internet, then you're very welcome to give Healthwatch a call and we can have a look at services for you in your local area. And the phone number comes at the end of the presentation. Pharmacists are able to perform lots more services than they used to be. So they can offer clinical advice and offer over-the-counter medication. And that includes for things like coughs and colds and flu, any sort of tummy trouble, aches and pains, things like cystitis and access to the morning after pill. They can also help you with repeat prescriptions, managing those and taking any questions about your medication. For residents who might not have English as their first language, you do have the right to ask for an interpreter when you go to see a healthcare professional. If you're visiting the GP, this can be arranged through a service called Language Line, and the practice should organise all of that for you.
So just to let you know about some of the areas where Healthwatch has improved awareness of autism and special educational needs in Islington. Having sat on the Autism Partnership Board, Healthwatch was aware that there were parents who felt GP practices were not really aware of how best to understand the needs of families and children with learning disabilities. And we coordinated a mystery shopping experience where some parents could ring some GP practices and see how they would be able to accommodate the needs of people with autism and learning disabilities. We produced a recommendation, and as a result of this, some really positive action has taken place where there are now annual health checks in place for autistic patients, provision for training for GP practice staff, and also environment checks of GP surgeries have been introduced. These are carried out by parents of children with autism and other special needs. Healthwatch has also been involved with Centre 404 and producing a report on the supporting family services and how effectively they support families and carers of people with learning disabilities.